Katika kipindi tunakuletea wasanii.
What's up my guys, I go by the name Rainams.
Eti nikipita kwa macho na nipimia, na kama sina pesa unguwezi nipimia. Hapa Shenster the Poet manze.
Ngoma moto moto.
If you wanna show some love, but don't fake it too. Hey, kumenya mawazo makuu. Nani anadera shida? Oh, utani waku.
Vichekesho. Mkisongaza. Mahojiano moto moto, stori za wasanii pamoja na talanta za wasanii.
Fiki wa kasi gani kama wapatikani wakati wa shida.
Na pia kwenye kipindi utabambika, utajijenga, utaelimika, utakuza talanta yako.
My name is Rebecca Mutie, I'm a model and I'm Afri Kenya. I'm a student. Napenda kusikiza kipindi cha Bonga na Katoni kila Jumatatu kuanzia saa 9 mpaka saa 10.
Kumbuka ni kwenye Bonga na Katoni ndani ya TAS TV kuanzia saa 9 hadi saa 10 kila siku ya Jumatatu.
This is Bonga na Katoni in TAS TV. Karibuni.
Good afternoon. It's another beautiful day and we get to meet here once again for counting the red ribbons. And as you can see from this studio on this particular day, I have such a huge panel of, panelists. We're here to talk about pediatric healthcare and especially heart conditions, looking at the wins and the challenges and what an amazing organization is doing in the country just to make sure that they help kids go and get successful surgery in India. So without so much talking, remember this is TAS TV. Please follow us on our social media platforms at TASTV_KE on Instagram and TikTok, at TASTV_official on Twitter, TAS TV official on YouTube, and TAS TV on Facebook. Without so much talking, allow us to get straight into today's episode. Karibuni sana. Thank you so much for coming. So maybe just to go straight to the introduction part, I'll start from the farthest end. Please introduce yourself and tell us who you are.
Hi guys, my name is Catherine Omboy and I'm a beneficiary from the organization we started here with.
Mm-hmm.
Yeah.
Okay.
My name is Margaret Nyawera. I'm waiting to be a beneficiary of this organization.
Okay, interesting.
My name is Steven Menyasia.
Mm-hmm.
I'm a beneficiary.
Interesting. And now before we get to our boss, let's jump to this other side and then we can now go back. Okay, please.
Well, my name is Stanley Ngara, popularly known as King of Condom, but now I'm a kids ambassador. I'm dealing with children. I'm the country representative of Vodacare Health Limited, and here I invited one of the directors from India. We are 3 directors, and I don't want to preempt the introduction.
Please don't.
I just want to see who I am, and what we have, and where we are going.
Interesting.
Yes.
And now let's get to the chairman.
The director.
Yeah.
The chief director.
Thank you very much.
Yes.
So my name is Amir Siddiqui. I'm from India.
Yeah.
And I have a company that name is Revocure. And its vision is to work beyond the borders. It's our tagline.
Yeah.
So basically, we are here. We are helping kids to get treatment in best hospitals of India. Currently, we are in partner with Marengo Asia Hospital for the cardiac thing.
Yeah.
Because the Dr. Rajesh Sharma is one of the best doctors in India in treat cardiac thing. And we are funding the kids who don't able to, not able to afford the treatment. Basically, we are connecting, donors to the patient.
Yes. Okay, that's
and
interesting.
That's the thing. And in this process,
Yeah.
fund will directly come to the hospital. Okay. kids will get the treatment, and if any single penny will left in the kids hospital account, which we call UHID, unique identification number, unique hospital identification number, let me clear this, so those money will return to the donor.
Okay.
So here we came to erase the borders, basically.
Yeah.
That's the agenda of the Revocure.
Ah, interesting. So it's basically health beyond borders, and we are crossing all over just to make sure that we give our kids the best. So just a quick question, why Africa?
See, we are working with CIS, Russian country as well.
Yeah.
We are working with SHARC as well, like we did MOU with Bangladesh biggest educational institution. It's like BSMMU is the single university in the Bangladesh, and under this all the institutions and colleges, many institutions and colleges came. Apart from that, we are under MOU with the Health Ministry of Uzbekistan. Very soon we'll do MOU with the Bangladesh Health Ministry. We already proposed them, but due to the election they postponed the signing date. So we are not only working with the Africa, we are working with the kids who required help.
Okay.
Every part of the world. Any part of the world. No country preference we have.
Yeah.
Because kids don't know the border. They can cross any borders without any passport.
Okay, yes, interesting. Thank you so much for that clarification. And now just to jump straight to our first beneficiary, I believe you were among the first parents to travel to India with your kids. Could you talk to us about, before we get to sharing your experience on the other side, please give us an overview of your child's condition and how it was and the journey. Yeah, just briefly, please.
Okay.
Yeah.
So my third one was born with heart condition, where she had to go for surgery, multiple surgery. Yeah, so she had a VSD, she had pulmonary stenosis, she had an aortic switch down her. So they couldn't be done once, and it couldn't be done here in Kenya.
Yeah.
So from when she was born, I knew they needed to go to India.
Yeah.
I told you needed to go to India. Yeah.
Okay. How about you?
Okay, my baby was born with without one side of the heart, no valve, and also she had the PSD. Yeah.
Okay, so how was the experience for you traveling to India? Were you not scared?
Actually, I'm not the one who went to India.
Okay.
It's the mom.
Okay, interesting. So maybe if you did go, please talk to us about that experience. How was it going to the other side?
For me, it was okay. I met good people who are welcoming, and they helped me through every step. So it was easy for me.
Okay, interesting. So now talking about, we have Revocare, which is like the organization that's helping kids go to India to get the medical needs. Maybe Ngara, you can give us a brief of that. Talk to us about Revocare, the whole project, and what exactly do you do aside from just, helping the kids? What are you taking care of, and what is the parent taking care of?
Thank you very much. I'll talk about what we do in Kenya.
Yeah.
And then in India, because he's the one who received them in the airport.
Yes.
Mine is to send from Kenya to airport. One, I'd say we have so far successfully managed to support 9 children.
Yes.
And as we are sitting here, we have 3. We have 3 in India or 2? 3. We have 3 in India that are undergoing treatment, and we are very proud of that. Our job is to penetrate through network.
Yeah.
There are so many health WhatsApp group, people with the same challenges coming together. We have doctors, we have clinics, we have organizations, NGOs that are supporting children.
Yeah.
We look for cases that cannot be managed in Kenya. So we look for most challenging, and we look for patients that have been referred to India.
Yeah.
We come in not as an agent,
but
as a consultant to help.
Yeah.
One of the things that we do, we send the medical report to his office.
Yes.
Our Revocure office in India that pick all the document. Then he'll tell us what to do once we send.
Yeah.
We send the passport.
Yeah.
If we link our patient with the agent who will book the air ticket, fit to fly, all those documents. We also help them to get visa. We guide them, not help. We get them how to process the visa.
Okay.
When they get, when
they've been approved.
They have been approved.
Okay.
From India.
Okay.
So it is very easy. And then we link all our patients with our beneficiaries to comfort them, to tell them what happened in India. They can do physical visit. That is a support. They do it voluntarily. They can do physical. They can call. We have a grid that we can share their number. They tell them, yes, this is happening. I'm a beneficiary, and this goes on.
Interesting. So once, sorry.
No, so that's very good. So ours is to collect data and to make sure that everything is in system.
Yeah.
So we want to have a system that every other person come through the Kenyan office, then we go. So as we can track, we can support them.
Okay.
If it is NHIF, we have challenges so far with NHIF because of the time. NHIF take 40 days to pay, 45 days to pay. And most of the people, maybe I can talk, but you can say it's better. We have a lot of patients whose NHIF have not been cleared in India.
Okay.
And most of the hospitals are not admitting any person from Kenya because he have not been cleared by the
NHIF. Okay, interesting.
So we come in and he will tell us how he supports from the Indians.
Okay, so once you have the documents, you now want to link the doctors and the kids so that they get to understand. Talk to us about that whole process.
Basically, once we got the medical document, we send those documents to the doctor.
Yeah.
Doctor evaluate the case through the document, medical document, and accordingly he suggests what surgery or what kind of treatment the kid required. According to the doctor suggestion, we get the PI performer invoice from the hospital. We'll send those PIs to the patient or the parents of the patient. Like Stanley received those PIs and he forward ahead.
Okay.
Like he is the one who is handling all the things in Kenya. So all the things should go by Stanley only. So this is the thing. Then after that, once if we are funding 80% of the fund, arranging the funds for them. But if it's beyond our capacity, like we have some caps, so if it's beyond our capacity, we tell parents to arrange the left fund basically, and we are the one who is sponsoring biggest chunk. They are just arranging 20 to 30% treatment fund. Just arrange those funds and come to India.
Okay.
You need to deposit those funds in hospital only. You can deposit here as well before coming. You can send in our account. This will be, you will get in your hospital account. Because we are under partnership with the hospital. We are under MOU with the hospital. So we are acting as a partner of the hospital.
Okay.
Our company. That's why we are able to put pressure to get maximum discount.
Okay.
In pediatric case, we are funding, so they are doing discounted treatment as well. But in adult case as well, they are giving us discounted rate. For example, if you are getting $10,000 cost for any surgery and you went through us, you will get the revised price. It may be $8,500. It might be $9,000, but you will get discount.
Okay.
Because we are working as a social entrepreneur, so hospital regard us, hospital gives us the maximum discount.
Interesting. So to get it clearly, you're saying that the 80% is done by the organization Revocure, and then the 20% is done by the parent.
The partial funding, basically, you can say. It's not a fully funded program.
Okay.
Partial funding, it depends case on case, how much we are going to fund.
Okay.
It depends on case to case and the costing of the case.
Yeah.
But we'll fund. That's for sure.
Yeah.
And you will get benefit. Apart from that, our car will pick you from the airport, take you to the hospital. You will get all the facilities, and while you are staying outside of the hospital in guest house, for you coming to the hospital and going to your guest house, will provide you cab. Cab will pick and drop you, so you no need to worry about the travel. And for the hospital thing, you just book your ticket and get fund for your stay and the food.
Yeah.
And for the partial amount for the treatment, and come to India.
Okay.
Rest will take care.
Interesting. So, Mom, I trust that you're looking to travel to India after several attempts to get the service in the country, but you couldn't. Talk to us about that. How was your experience like before making the decision to go to India? First brief us on what condition your baby is going through or is having, and then the experience.
Okay, my daughter was born with annular malformation, a condition that before she was taken she was supposed to be taken for surgery to get a colostomy for her. So that's when they realized that she has a large VSD with hyperdynamic BAH. So we were told to fight funds and go to India immediately because it was emergency.
Yeah.
So we were not able to raise the funds. We got a camp which was coming to Nairobi, and we went. She was done a PA banding, of which we have tried to. She has gone several surgeries for the annular malformation, and we were supposed to now go for the heart surgery, of which we were told it cannot be done here in Kenya because there is difficulty in reopening again. She was done an open heart surgery, and she was supposed to be done at the second open heart surgery.
Yeah.
So that's when I did all the processing of the papers, and the hospital was supposed to go too bad because they are not accepting the NHIF cover anymore.
Yeah.
So the funds I had, I wanted a boost from the NHIF, of which it was not possible.
Yeah.
So I did all what I could to see my daughter have the funds to go there. That's when a well-wisher found me on the streets of Nairobi, and she directed me to the chairman here, Mr. Ngara, and that's where he did all what he wanted. He was supposed to be done, and that's why he's getting me to that journey and have the surgery done in India through the director here. And I'm hoping it will be a good journey and a good process, because I'm hoping my daughter to get
better. Okay.
Better.
How has it been like making that decision?
Yeah, you see, when you have a sick child, you listen to any advice which comes along with you. So the moment I got the encouragement from those people who have been beneficiaries of the process, I talked to Kate here, I talked to Steve, and that's why when I decided to proceed with the revocare, because at the moment I don't have any other choice, and because they told me that their experience was fine and they have seen good improvement from them, that's why I approached Mr. Ngara, and he is taking me on that journey to get the treatment there.
Interesting. Now, as beneficiaries, and especially to you, Steve, because you were left in Kenya and your wife and daughter were in India, how was it like for you? How were you mentally?
Okay, it was not an easy one. It was a tough one. And through a lot of consultation from Mr. Ngara, from Mr. Amir, we were able to go through. Yeah.
Okay. So throughout the whole period, you were in constant communication with your wife just to get to understand the whole process?
Yes, we were in constant communication.
Okay, and as for you, Kate, you being there, you being present, how was it like for you? How are you doing mentally, knowing very well that my daughter is inside there, she could come, or how was it for you?
It was not easy. It was not easy at all.
Yeah.
But you just pray and trust in God. Because
Yeah.
you've done your best. So you leave it to the doctors, and even the doctors, they told me, we'll do our best, we'll leave the rest to go to hell.
Yeah.
So you have no option.
Okay.
You have to be strong.
Interesting.
Because your baby needs that strength from you. Yeah, tell you to be strong and mentally stable.
Okay.
And also they were talking to me. They used to visit, they talked to me. And they walked with me through the whole journey. Like when you were going for surgery, he was there the whole time.
Yeah.
Yeah, and I was grateful for that. It helped a lot. Yes, I was not alone.
Okay. So, Director, maybe just to make our audience understand better, do you provide counseling during this period before the parent lets the baby go into surgery?
Yes.
Because most of the time we have, the last thing a child would always remember is akona mama, he or she has is with the mom or dad. So do you offer counseling, and how is that process like for you, having watched most parents letting their children go into surgery because they're not allowed inside?
Yeah, basically the counseling is done by doctor only. Because you came to doctor,
Yeah.
not to me.
Yeah.
Doctor is the one who is going to treat your kid. So always doctor do the counseling. Doctor make them understand all the challenges
Yeah.
which is going to come in the operation process, like what's the chances.
Yeah.
See, doctors always say it's a 98% successful success rate and 2% is the
Yeah.
risk ratio. But for the patient's family, it's 100%. Like either this side or the another side.
Yeah.
It's 100% risk. So if you made your mind, and either way your child is not going to survive more than 1 or 2 years with this illness.
Yeah.
So better give him or her a chance.
Yeah.
So parents understood this thing. We were there at the time of the counseling, and apart from that, when they are out of the ICU or the operation theater, me or my team or the hospital staff was there. So like this we try to just make them comfortable for the duration of the operation, because cardiac thing will take sometimes 4 hours, sometimes 8 hours.
Yeah.
So parents started panicking. It's a basic human nature. You need to understand this. But once the doctor will come out from the theater and they say surgery is successful,
Yeah.
all things are vanished now. Only happiness.
Okay.
And I'm very happy, like every kid which came to us is that went with the surgery is now living his or her life happily and healthy.
Interesting, which is good news to any other person who's looking to travel. And now to you, Mr. Ngara, we have the Revocure project in the community. How is the reception like? How are people taking this project? Is it something that they're accepting? Is it something that they're believing in?
Wow, that's a good one. And I can say as per today, every day we get 2 to 3 requests. So there's a demand. And the challenge is people don't have money, they don't have passport, but they have the need.
Yeah.
So if there is a smooth operation, I'm sure we could be sending 5 to 10 children every week to India.
Yeah.
The other thing I want to magnify, and I want it to come very clearly, further to Elsie,
Yeah.
the child stayed in ICU for 28 days. And that was the most difficult time for this man.
Yeah.
Because he thought, I have a screen and I can see what is happening in India.
Yeah.
He was calling me.
Yeah.
And when he tried to call the wife and he is not available, he will call me to call me and explain what is happening.
Yeah.
And I think patient is one thing that is helping us, help the babies.
Yeah.
Because it has to be from your heart. And he can explain the condition of the baby. Because that was one of the most difficult issue I can say we have encountered.
Yeah.
Because even the doctors in Kenya were saying, try India, and I'm not seeing the possibility of succeeding. Maybe he can say it from his own mouth, not me.
Okay.
Because
So what was your experience like with the Kenyan doctors before now making the decision to actually take your kid to India?
He had a time limit. That was what was scary.
Okay. Talk to us about that.
Okay, when the baby was born, we took her to Nairobi Hospital.
Yeah.
The echo was done there. After the echo was done, we were told to wait until the baby attained 10 kgs. But you see, the issue was, this week the baby will have 100 grams. Next week we'll go for normal clinic. The baby has already lost the 100 grams. So it was very difficult for the baby to attain the 10 kgs.
The 10 kgs.
So we had to look for alternative. So the alternative, we took the baby to Kenyatta National Hospital.
Yeah.
When we went there, the doctor who did the echo, he said, this one is a serious one. The baby has high pressures.
Yeah.
And if the operation is not done as soon as possible,
yeah,
the pressure might damage the heart.
Okay.
So that was actually the baby was 6 months old. Now, and the operation was supposed to be done when the baby was 3 months.
3 months.
So now we had to look for funds as soon as possible. But now we didn't have the funds, so we had to look for the money now from the people.
Yeah.
It was not easy. We tried all the social media, nobody was coming. Nobody was responding positively. Now, I got a call from Kate.
Yeah.
Kate told me there's this guy called Mr. Ngara, so you can call him, you can send me the report from the doctor. We first see how much the surgery might cost. So I sent Kate the report.
Yeah.
Now after sending Kate the report, immediately she sent me the whole invoice and everything. Now I told her, even this one is more expensive even than the hospital that Kenyatta has referred. So now she told me, just call Mr. Ngara, explain everything, send the document, and Mr. Ngara will be able to guide you.
Yeah, okay.
That is what I did. I sent the documents to Mr. Ngara.
Yeah.
But I had doubts. Mr. Ngara is telling me I can fund 80%. But me, I've been raising 1.5 million for almost 3 months, and I only have 300,000. So it was. Then I told my friend, a close friend of mine, now I have this Mr. Ngara who is funding. He's the Ruhumid.
Yeah.
So I told him, I don't trust this person.
Yeah.
This one is a hard one. Then I also called my auntie. I told her, now auntie, this is what you are going to do. Next week on this time, we are going to Thika to see Mr. Ngara, so that he can expound on us. So that you people, you will not say, I released my child to go to the hands that I had not
done your due diligence.
Yeah. So we came. When we came here, he explained everything, and then he said, no, you have a witness, Kate is there. Kate can testify that whatever we are doing is right, and we are truly helping.
Yeah.
In that process, he called Mr. Amir.
Yeah.
And Amir explained to us. Now we gained the confidence.
Yeah.
Of now we can raise the air ticket, we can raise the accommodation fee, and then we send our baby to
India.
Now that one came up very fast. It opened up very fast because my wife had the passport. It is only the baby. So I processed I was sent the invitation letter from India.
Yeah.
I went with it to embassy.
Yeah.
Indian embassy. They processed it for us, and then I was able to send the baby
to India.
Yeah.
Okay. So, having listened to the beneficiaries' stories, how does that make you feel?
Yeah, it makes me feel encouraged. And since I've heard about their procedures, how they go about them, how they help, I have no other ways, but I have to.
Yeah.
Yeah,
Oh.
all of them, because all the other sources I'm looking forward to, there is no light. So I decided this one I have a testimony about from this one and this one.
Yeah.
Let me do it.
You have to give it a try. Okay, guys, so remember we are talking about pediatric healthcare, looking at beneficiaries of the Revocure project. In case you don't know about that, they are an organization that's helping kids all across the world just to make sure that they're sent to India and they get to have successful treatments, so that, and then at the end of the day they come back home. So right about now we are headed on a very short commercial break. When we come back, we're going to be discussing more on the same. See you guys in a bit.
This is the newest, most exciting entertainment show where nothing is off limits. We bring you real, authentic, and raw conversations. Enjoy good vibes, fashion, and lifestyle from your favorite celebrities. Fun, trending topics, games, and educative segments. Every Tuesdays from 3 p.m. and Saturdays from 4 p.m. to 5 p.m. With me, Lavin Nyagoa and Hazel Jeru. Only on The Unfiltered.
Katika kipindi tunakuletea wasanii.
What's up my guys? I go by the name Reynams.
Eti nikipita kwa macho unanipimia, na kama sina pesa unguwezi nipimia. Hapa Shensta the Poet manze.
Ngoma moto moto.
If you wanna show some love, show some love, I don't fake it too. Hey, ndakumenya mawazo makuu, nani anadera shule, warutani wakuu.
Vichekesho mkisongaza, mahojiano moto moto, stori za wasanii pamoja na talanta za wasanii.
Muziki wa kasi gani kama wapatikani wakati wa shida.
Na pia kwenye kipindi utabambika, utajijenga, utaelimika, utakuza talanta yako.
My name is Rebecca Mutie. I'm a model and I'm Afri Kenya. I'm a student. Napenda kusikiza kipindi cha Bonga na Katoni kila Jumatatu kuanzia saa 9 mpaka saa 10.
Kumbuka ni kwenye Bonga na Katoni ndani ya TAS TV kuanzia saa 9 hadi saa 10 kila siku ya Jumatatu.
This is Bonga na Katoni in TAS TV. Karibuni.
What's your name?
My name is Kevin Kakum.
Kitui Francis. From which school?
Kenya Institute of Mass Communication.
Kenya Institute of Mass Communication. What did you learn while at TAS TV? Improvement of my skills in graphics, such as motion graphics, video editing, photography, also communication skills.
Camera operations, video editing, and improved my skills in graphic design.
Would you recommend anyone?
Yes, nilikuwa hapa TAS, skills zangu zili improve on communication with fellow co-workers and teamwork when doing certain projects.
Yes, new skills in photography. Communication, I have built more in communications through interaction with other colleagues or people outside there. On a scale of 1 to 10, how would you rate your attachment at TAS TV?
7.
8. Generally, what will you say about TAS TV?
Wow, it's amazing being here.
I think it's the best place to be. Yeah.
Welcome back and thank you so much for staying put. Remember, we're discussing pediatric health. Our focus is on young children who have different conditions and actually want to travel to India to get help. And we have an organization, Revocure, who's working hand in hand with these parents. So in case you're out there and you know somebody who needs help, then you could actually reach out to us. You could come to TAS TV. We are located in Thika Town, Nema Plaza, 2nd floor. We have Revocure with us. So just by getting to our studio, you'll have gotten to Revocure offices. Okay, so away from that, before we went on that break, we were talking to our beneficiary who's about to go to India for help, and you have a very unique story. Talk to us about that story and how your experience throughout the period that you were out in the streets just to make sure that you try and raise funds for your baby. How was it like?
It was hectic. Since birth, I've been on and off in hospital, going to people requesting for funds, and it reached a point that I have done 3 Harambes, of which I didn't even raise the quote amount of money I was supposed to have. So it's like the time I met the Healing Little Hearts camp, they told me, you still have to raise funds and go to this and this hospital. So it's like I told them the money I was having. So they told me, go process the papers and be set to that place. We will help you wherever you'll be stuck. So it's like I processed all the papers. I went to Kenyatta National Hospital. I got the letter from the cardiologist. Took it to the KMPDC CU. Then I went to Ministry of Health. Everything went smoothly, though it took time. On reaching to the NHIF, that's where it hit me. After taking my papers, they told me, no, you know what? The GOP we are giving you, the hospital you're supposed to go, they're not accepting it.
NHIF.
The NHIF, yeah. So it's like, now what do I do? Yeah, I have my baby on my back. She has fever. So I wondered, what do I do? I went back a broken heart person. I went to town. So that's where I decided, now I'll go to anyone who I get on the way to help me raise the funds which are supposed to be to be paid by the NHIF. I see my baby is okay.
Yeah.
So that's where I came across a lady. The lady told me, you know what? I told them I don't even know where to go because I'm supposed to go back to my village. I don't know, tomorrow I'm supposed to go to this office, see whether I'll get help. So she told me, you know what? I'm so touched by your story because I told her everything. She told me I may not be able to give you the funds you want, but I'll assist where I can. I can talk to 2-3 people. I see how they can assist you. So that's when she gave me accommodation, and she talked to Mr. Ngala, then to Mr. Amir, and that's why when I was told, you just wait. We process all these things about the NHIF, maybe we can see how we can assist you.
Yeah.
So it's every day I was keeping calling Mr. Ngara, asking him what do I do? This thing, the band which was put on my kid, it's outgrowing her. She's now 2 years, 3 months, and I'm panicking. I don't know what to do because the cardiologist told me it is supposed to be done as soon as possible.
Yeah.
So with what I had, I saw now the world has come to an end because I don't know what to do. This thing, Mr. Ngara told me, I'll see on to that. We're waiting for our director so that maybe we can talk about 1, 2, 3 about the NHIF and see how we will help you.
Yeah.
So today I was called, I was told, come and meet our director, you go and talk out your issues, but then we see how he will help you.
Okay.
And I'm so happy because I got a well a warm welcome. I see as if everything, the burden which I was on my back, it's now, I feel I'm now relieved because I see there's light at the end of the tunnel.
Yeah.
And I'm so much grateful to Mr. Amir because according to the support he said he'll do it to me, I see here.
There's light.
God has come. He has sent someone to come and help.
Interesting. So, Mr. Amir, maybe to other parents who are also going through the NHIF issue, where certain hospitals cannot be funded by NHIF, how do you go about that?
Basically, I came here to meet with the officials of the NHIF and other hospital officials.
Yeah.
So we'll discuss with the NHIF because we are the one who is funding hefty amount and they are just funding a small amount.
Yeah.
So if they can coordinate with us, they can collaborate with us, they do the agreement or MOU, they will give us the assurance like they will pay in certain days. That will be very helpful for the Kenyan people to come and get treatment. It will become free of cost like the thing for other patients. Like we are funding, NHIF is funding, so then they just take care of their flight and the accommodation. The rest, we and NHIF will together take care. So that's why we are trying to meet NHIF officials. One will sit in the meeting. I will offer them this proposal. If they will accept, then that will be great. If not, then we have some limitations.
Yeah. Okay. So to our beneficiaries, I'll start with you, Kate. How then can we raise awareness about NGOs like Revocure who are actually helping kids go and get help outside the country, having looked at you as somebody who's benefited from them, and that not so many people, it is a new project, so not so many people really know about it, but we are still trying to spread that awareness.
Yeah, we can use our friends, social media, because I think it's social media. Right now everything is social media.
Yeah.
So I would like to share the story, we share about the organization, and so that you can reach more people.
Yeah.
I believe through social media we reach more people. Because according to them, they don't want kids to die because of funding. Because kids are dying because of funding. I know so many people who are still in Kenya. They're supposed to have taken their kids to India, but they can't. They can't even raise money for food.
Yeah.
Okay. So you can imagine how he's going to help someone. You can imagine the difference it will make here.
Okay, so and to you, Steve, probably some of the efforts that we need to improve on or increase just to make sure that the project is more known.
Okay, for me, I'm open. Anybody wants any consultation? Anybody wants to any proof? I can stand for them. They can call. I can take them through the process. I can show them my baby so that they may know that this one is real. It's not something that is fish.
Yeah. Okay. So to you, Ms. Tangara, having experienced both the healthcare side in Kenya and the healthcare side in India, and as a country representative for Revocure, what are some of the things that you'd mention or rather you'd highlight about the healthcare system?
One, I'm so grateful for my director here because in January I'm traveling to India because I have to see what is on the ground. The way he have visited here. We have a meeting in India in January. And also we want to do a dummy as something that can be copied all over Africa. And we want to do teleconsultation here. And we are going to use the tools that we have here, the system that we have here, that people before they go to India, they have seen the doctors live, they have been given consultation online, and they will make a decision whether to go or not to go. Number two, we want to ease the burden of parents, and we want to look for genuine people who cannot afford, that needy person that cannot afford to go. And I'm really touched with her story because there is this organization called Heart Careful. Child Heart Foundation that have done a lot. They have like 78 children that they need to support, and we want to do an MOU with them, and we even ease the burden with them.
Yeah.
We have Little Heart in Mombasa. We are visiting them. We also want to do an MOU, and we're also calling in Kenya any other person who have a heart to support children to come in. We work together, and from the initiative now that we are having, we will look for a partner, maybe Kenya Airways or any other flight, or any other company, or like Safaricom, our friend. We can agree that they can do one flight, one way. The family can pay
the return
the
ticket.
return, or we look for well wishers. Now instead of them looking for medical, we fundraising for care and air ticket, and that is our goal where we are going. Yes.
Okay, so Mr. Amir, you mentioned that you're collaborating with different countries across the world. So how has it been so far? How is the impact like?
Impact is like till now we helped 350 kids and many adults, and now we are trying to open a clinical corridor. See, our vision is different. We want to strengthen, country's health infrastructure, who is, completely backward from India. So we are trying to start a clinical corridor. Like, we'll train your doctors, your nurses, your technician back in India, our hospitals, and they will get certificate for that. So when they will get the training, they will come back to the native country and serve their people.
Yes.
So we need to strengthen those, infrastructure. So in future, I believe in 3 to 5 years, nobody need to fly for the treatment from here to any part of the world. And if required, this will be a very serious surgery, which is not available in the country, because many surgeries are not available in India, or either available but people fly to America for get treatment because they have lots of money, so they need to burn those money somewhere. So my agenda is very different. Apart from that, Revocure will do teleconsultation things, like will connect doctors with the patient, so they will get first hand assessment from the doctors only, and if they require medical management, doctor will do, prescribe the medicine, they will buy medicine from any medical store and take care of themselves. For that they no need to go to the India, and if they required any surgical intervention, then only they need to fly to India, because we encounter with many cases, people require just medical management, but here doctor suggested something else. They fly to India, they go to the hospital, and where doctor just write it down, okay, this tablet in morning, this tablet in afternoon, this is the night for 1 week or 1 month, and you will be fine. You can go now. So for this only, they took all the pain, and they spent lakhs of the rupees, 100 and 1000 Kenyan shilling they are, spending. So I just want to cut this crap. That's why it's Revocure, and it's beyond the border. So you no need to cross the border. You will get all the things what you will get in India, but digitally. And if you will, then at last doctor will tell, like, you need to come to India for the surgery, then you will fly and meet physically.
Okay, interesting. Now, to you, our beneficiaries, what are some of the ways that you'd like the healthcare system, and especially in the country, having had different experiences with the healthcare systems within Kenya, what are some of the ways that you'd want that improved? Because I understand it's not the first time your daughter is getting a heart surgery. It's also not the very first time your daughter is having a surgery, and you too. So what are some of the ways that we could actually help improve the healthcare system in the country? I'll start with you.
One is to make the NHIF pay for the bills. Without delay. Because if they delay, they are hindering somebody from getting treatment at the right time.
Okay, interesting. How about you?
They should at least educate these parents who are coming across such conditions.
Yes.
Their babies are suffering, You know, you maybe every condition that comes with every heart condition that comes around comes with another condition. So it's so traumatizing.
Yeah.
They should be offering even therapy, counseling to the mothers, the caregivers.
Yeah.
Because most of us are psychologically tortured by the because you know
By
you
the
go,
impact.
Yeah, you go to the village, you see someone saying that maybe you're bewitched, you are going through. Everyone you come across is that you are going to ask for money, so you are singled out.
Yeah.
You're all alone. If it comes to families, you see there is separation. Then maybe the husband sees that this is too much, or the parents, you know, you're left alone with your burden to carry, because you come to a point that you exhaust all the funds you have because of the cases you are going through. Then they should, at least the NHIF should try to cater for the bills.
Yeah.
Maybe you are sent for an echo. You go, maybe some hospitals you're charged 13,000. You go to Kenyatta, you're charged 35, sometimes 45. You know, every clinic you have to go and pay 1,100 shillings. You see, this too much. You catering for ticket, for fare to and fro. It's a lot.
It's a lot.
Yeah.
Okay. How about you, Kate?
For me, I would like them to educate people on these conditions. Because for my case, it could have been noticed before I gave birth to the kid.
Yeah.
Yeah. And we could have maybe took different measures. So help people understand about these conditions. There is more awareness. We know more about it. Because me, I had to go back and start researching.
Yeah.
After I was told, you know what, your baby is very sick. And she has a heart condition.
Yeah.
And the doctor was dying. So you had to research and understand.
On your own.
Yeah, on my own. So we need these doctors to tell us more about these things.
Yeah.
Yeah.
Okay. Now, to you, Ms. Tangara, Kate has talked about letting this be known from a very early age, or rather raising awareness so that many people get to know this. Why do you think that this is not given the front line like HIV is given? We have malaria, communicable diseases are given that front line. What are some of the ways that you think we should go about this?
Well, thank you very much. One, I want to say that we are a registered company.
Yeah.
We are not an NGO. We are a registered company, Revocure, which are, we have India Revocure and Kenya Revocure, and we also go all over Africa.
Yeah.
Number two, we are social workers. We are not doctors.
Okay.
No, we have doctors in our team.
Yeah.
Yes,
we have doctors in our team, but we call ourselves as a social entrepreneur.
Oh, okay.
Yes.
Okay.
We are investing in social, and we have like 500 doctors on our hands.
Yeah.
In our panel.
In our panel.
Okay.
That we are working with. And we want to assure Kenyans and every other in Africa that the heavy medical health issues they are carrying, we can lessen the burden.
Okay.
Number two, I want also to see these are public health, we call it public health education. We want to work very closely with the public health education team in the government to create awareness more. And I say it is very easy because we have the skill, we have the know-how of mobilization and creating awareness. And we are also going to use our online tools that we have in promoting this. We need to do health promotion as on health, on the heart and children, and also bringing up children. Because what I can see a lot of potential with our beneficiaries, where they can go and not hire to train other people before and during birth and how to take care of their children.
Okay.
I can see a lot of potential in this.
Okay, okay. Now to our beneficiaries, as we come closer to the end of the program, how has this whole experience impacted you as a parent? Let's start with you, Kate.
A lot. Because I didn't know about things I know now. Through going through that journey, helped me understand a lot. And I did a lot of research, even on other diseases. Okay. So before I was blind, or I didn't want to know more.
Yeah.
Until it occurred to me.
Yes.
I had that case. So yeah, it has impacted me a lot. And I would like my kids, traditional, I'm teaching them to understand the kid.
Yeah.
Yeah, she had her condition. Even her, she's asking questions. What happened to my chest?
Yeah.
So she has a scar.
Yeah.
She's asking me what happened. And I tell her, the doctor cut you. Then she's like, why? So I have to teach her. You know?
Yeah.
I would even like her to become a doctor. She'll understand the patient
more.
Because she has gone through that.
Exactly.
So you learn a lot. It humbles you. It allows you to learn more. And even when I'm walking on the street, I started noticing kids who are sick before I didn't notice.
Yeah.
Now even I can approach. I do approach some of them, and they ask, what have you done for your kid? What are the messages? Some even don't know. They don't have the information.
Yeah.
Yeah. So I try to teach them, talk to them, advise them. Yeah. Tell them there's a way. You know, some have been told nothing
Can be done.
for this
Yeah.
kid. So I'm telling them there's another way.
Yeah.
Yeah. So they need the knowledge. The knowledge to know these things. Yeah.
Okay. To you, how has it impacted you?
First of all, even to the other siblings, it's so traumatizing. Like my son even didn't perform the way he was performing before because of the sister's sickness. Because it's like that time she was having a colostomy. My son could chase all the other kids. Maybe there are kids in the house, chase them away so that I can change her the colostomy bag.
Yeah.
So it's like every time he goes to school, come back, tells me, Mom, mtoto wetu alitibiwa. How is she now? So it's like every time, whenever I call him in school, maybe he want to call us and know about our status, how we are doing. Maybe have we gone to India, or how is the sister doing? It's like that's the first question he asks. So there is much needed even to educate people to see this not some curse or something. These are the real things which are happening to our lady. You go towards, you see so many kids with such conditions. Even you stay in hospital, you become like a doctor. You know you're supposed, from here you're supposed to go to this step, to the other step. Yeah, we need even people to encourage us and support us mentally, and physically and psychologically.
To me, it has changed me actually in a different way, because most parents, when they get these babies with congenital diseases, most men try to run away from these women. So this issue and condition of my baby has changed me a lot. So I can just advise men outside there. Once you're blessed with a baby with a condition, kindly don't run away from your wife. Stand by her, help her through the process, and God will bring blessing.
Okay.
Yeah.
And now to you, Mr. Director, to any parent who's having a similar issue or medical concern for their babies, talk to them.
See, if you are having any kind of medical issue with your kid, and if you are worried about things, so just come to us. We'll guide you, we'll help you. By any means we can help. Sometimes your kid required on time consultation with the doctor, and after getting the consultation, that will manage by medicine only. Because we dealt with some case, like same case from the Kenya, some hospital told them he's having cancer. But when he came to us, we run all the tests which exist in the medical history, and it's just reactive lymph nodes, which will be resolved by the 3 months of medicine. And now he is very fit and fine. He is gaining weight, he is doing swimming and all, and everything. No problem is having now. So that's the thing. Just come to us or consult with any doctor on time. With report, go for the test, the basic test required, and consult with the doctor. So you will get to know the cure on time. And apart from that, if you are doing delay, that will be dangerous for your kid and sometimes become deadly. because some surgery is required within 3 to 6 months in heart case. And if you are waiting for that, then that will reduce the success rate of the surgery. And sometimes you just require medical management. But if you not come up, then how could you know it's a medical management or the surgical thing? And rest, we are here. We will help you by any means. Mr. Angara is here throughout. Our office is here. So you can connect, you can coordinate with him anytime. 24/7 he is available. Okay, and then I will see you in India. Whatever you required, we'll do that.
Okay, so Mr. Angara, as the country representative, how can people find you?
One, let me say that we want to comply with all government regulatories. We want to be part with all boards, medical boards, that give authorization of what we are doing, and that is what we are following next week. We want to meet the PS of health or the CS of health, even the president, to discuss, because the last week our president went to India, and one of the things that he signed is a lot of agreement in supporting to developing a good relationship between India and Kenya. And I think we want to demonstrate that it has started. It is not stories are jamba, as people as people keep on saying. And people can get me in Neema House, second floor. That Africa, we share the same dream with them. Of your dream is our vision. And they can get me on TikTok, they can get me on Twitter, they can get me on Facebook, they can get me everywhere. Because I have a brand name that is known all over world, the King of Condom. And I want to put it this way. It is not a conflict that I'm giving children condoms. Yes. It is my soft heart. Children, and next time I'll give a story on how I started this project of children and how we met with my brother here, and how we have come together to share. Thank you very much.
Thank you. Thank you very much, guys. So I hope you understood something about pediatric healthcare, and especially kids who are living with heart conditions, not just heart. I believe there are several conditions that you're helping.
Any kind of critical illness.
Okay, any kind of critical illness. Remember, guys, like I said before, in case you're looking for Revocare offices, they're at Neema Plaza, Tante Africa Studios, or if you know where TAS TV is, that is exactly where Revocare offices are. So once you get to our offices, just ask what's next and where to. We'll be happy to serve you guys. Thank you so much, guys, for coming.
Thank you very much.
And thank you so much for enlightening our audience on the same, to actually get them to understand that these are conditions that can be managed. You don't have to die because you have a heart condition.
True.
Yes. So thank you so much. I really appreciate you guys for your time. And from us to you, we wish you a successful day and a happy evening. Have a blessed weekend. My name is Lavin Nyagoa, and this has been Counting the Red Ribbons. Get informed on what is happening in our political scenes and people who are making headlines in different parts of the country and the world, right here at TAS TV. Join me, Lavin Nyagoa, as I bring to you weekly news highlights that are factual every Friday at 4 o'clock. See you then.